Okay, guys, welcome back to another episode of Claims Denied. Today, we have the distinct privilege of talking to Nick Stefanese at Northwell Direct, CEO of Northwell Direct. He and I connected, what was it, maybe like a year ago or sometime around then when they first kind of announced their partnership with 32BJ up in the New York area. And so today, we're going to have a really interesting conversation, an area of high interest from a lot of folks around, direct contracting with employers and unions and whatever else that looks like. So, Nick, first of all, how are you doing today?
Doing great. Really appreciate you having me here, and excited to talk about direct contracting and direct to employer and direct to union healthcare.
Big time for sure. And maybe before we get into the meat and potatoes of that, how about you give me your background, your current role today, your journey into healthcare, and we can go from there.
Sure. So today, as you shared, I have the privilege of serving as the CEO of Northwell Direct, which is Northwell Health's direct to employer and direct to union business organization. I've been in this role for 6 years since we launched the business into the market, but have been a part of the Northwell Health extended family for the last 17 years. And so, I've had a really great journey with Northwell. It's a special organization in the sense that they really do move people around the organization, allow them to do and try and learn different things as they advance their career. And so I started in technology. I was chief of staff to our health systems CIO. Spent a couple of years there. I was the guy at every IT meeting who had to raise his hand and say, "Wait, what does that acronym mean? What language are you people speaking?" But an incredible learning opportunity to better understand how technology had the potential to transform care delivery. Then I spent time in our ambulatory organization, overseeing shared services support for our physician practices, really trying to think about how to make the providers' lives easier so that they could focus on their care delivery and interaction with their patients. And also developed some models around clinical joint ventures in things like urgent care, ambulatory surgery, dialysis, and the like. And then I was asked to move over to human resources. It was a great experience. And then in 2016, I was asked to make a pivot into the part of our organization that is responsible for generating margin that can be invested back into the clinical enterprise to support our mission. And so I joined the founding leadership team of a startup that we created with a private equity company that was focused on revenue cycle and patient access and engagement. And so I did that for a number of years. I was chief administrative officer there, oversaw all of our corporate support services, HR, marketing, compliance, things like that. I used to joke the things that the CEO of the business couldn't convince anyone else to take on.
You're the glue guy.
Ended up in my kitchen sink role. And then in 2020, they asked me to step into the role leading Northwell Direct. But I'm not a traditional managed care guy, right? I just walked you through my career journey. But I know the organization well. I have deep relationships across it. They had seen me operate in, sort of white space, and they knew I could build and manage businesses. And I think that's what was intriguing to them about asking me to step into this role. And it's been just a phenomenal experience over the last 6 years and really the entire 17 years that I've been a part of Northwell.
Yeah, so interesting. It's almost, it strikes me that your previous experiences almost culminated into this, right? Like you can see it from a tech perspective, from an ambulatory perspective, patient access, like it all kind of feeds into both the health system's mission at large, but maybe more distinctly into kind of Northwell Direct.
I think so.
Yeah,
I think so. And I'm sure this is true for most people's careers. You build skills, you gain experience, you gain perspective through all of these stops along the way. And even more importantly, you build relationships that you can draw on. And that's been, I think, the most beneficial. And I will say, the time that I spent in HR proper and then leading HR for a startup just prior to this. Number one, I built a lot of exposure and experience around the benefits space, which is certainly translatable and been helpful in the work that we do. But, a real appreciation for culture and organizational structure and engagement and how you use those things to sort of advance organizational objectives is something that I've really carried forward and tried to leverage in this role as a CEO. And so, yeah, I agree. It does feel like in a lot of ways, all of these experiences have prepared me for this role. But that's sort of the brilliance of Northwell's talent philosophy. There are a lot of people around our organization of 100,000 plus employees who have both been with the organization a long time and moved around it and done and experienced different roles and built similar different perspective and become kind of well-rounded operators.
Talk to me more about, you talk about kind of preparation and the culture of Northwell. Talk to me about how that set up Northwell to kind of endeavor into this direct contracting area. Like, first of all, why was it important strategically for you guys? And then two, how do you kind of set that up organizationally for success?
Yeah. So I think, one of the things that stands out to me about Northwell, and again, I'm biased. I've been here a long time. I love the organization, but, Northwell has a sort of deep rooted culture of innovation and really a culture of thinking of ourselves as bigger than the four walls of a traditional health system. And we take a really broad view of health, well-being, and the factors that influence health. And so whether that's been, us as a health system being willing to step up and talk about gun violence as a public health issue, whether it's been us, wanting to partner with community and faith-based organizations in a different way in the community, whether it's addressing issues of food insecurity or thinking about education as an influence of health outcomes. And, we started a high school of health sciences in the last year. So we've always thought bigger than what goes on in the four walls of our institution and felt an obligation to be part of solving for those issues that influence health. And, in our view, affordability is another issue that influences health and well-being, whether that is, people participating in insurance plans that they can't afford to use, or businesses and unions struggling to figure out how to afford to provide, good quality coverage to their members. And so we saw a huge issue emerging, and we felt an obligation as the largest healthcare delivery system in the state of New York. And by the way, also the state's largest private employer. We thought we had a unique perspective that we could bring to solving for this issue. And so that led us down the path of then how do you do it? And how do you do it in a way that doesn't burden a not-for-profit health system that's under, like all other health systems around the country, that's under tremendous financial pressure and constraint? How do you do it in a way that doesn't overly burden the organization with risk, but allows you to deliver meaningful solutions to the problem? And so those were the questions that we sought to answer once we had resolved that we were going to get into this fight. And that's really how we ultimately then designed the products and services that we're offering out to employers.
Yeah, and would love for you to, thanks for that background. That's super helpful. Can you walk me through what are the successful ingredients to employer direct contract, and maybe we can contextualize this. Maybe you can start with the framework and then contextualize it within the bigger deal that was announced. Maybe we can just start there.
Yeah, there were a couple of things, I think, a couple of decisions that we made early on that I think have been really important to our success. So number one, Northwell Direct is a business. We operate as a an autonomous business that is wholly owned by the health system, governed by a board of directors that I sit on with other executives from the health system. But it is run truly like a business with all of the discipline that comes with it, and it is a distinct operating entity. This is not somebody trying to do this off the side of their desk as an additional duty or responsibility, which we see in a lot of other peer organizations around the country. I think that decision brought a level of focus and commitment to this mission that has helped make us successful. Secondary to that, we thought about, well, how the heck do you operationalize a product for self-funded employers and unions? Do we need to become an insurance company? Do we need to be able to take risk? Do we have to build all the pieces and parts ourselves? And we went through a real process to sort of look at those questions. And where we ultimately landed was we didn't need to be an insurance company. We didn't want to be an insurance company. We didn't want to be in a position of burdening the organization with all that risk. And so we made a decision that we would focus on employers and unions that were self-funded in their benefit design already. We made a decision to focus on the things in the solution stack that we believed we were really good at. So building networks to provide care and managing care as patients moved through the care delivery system. All of the other enabling functions to allow this product to serve as a replacement for the incumbent insurance platform in an employer or a union, all of those other capabilities have come from partnerships that we've created. We made a deliberate decision not to try to do this all ourselves, but to find those that could be complementary and that could allow us to get into the market both quickly and with a product that we felt was reflective of the kind of quality. So I think when I look back, setting this thing up as a dedicated, formal business, thinking very strategically about what type of business it should be, and then deciding that we were going to have partners that would allow us to get into the market fast and with high quality. Those three decision points early on for us, I think, really set us up for success and for speed to market in the direct contracting space.
Yeah, that's fascinating. And so you kind of emphasized there, talking about like setting it up as a distinct business unit. Have you found that other health systems or other provider orgs are doing it kind of more within the enterprise and not doing that? And would you consider that a fallacy or the wrong way to do it? How would you kind of think about that?
Look, every organization's different. And so you've got to make decisions based on what's right for your organization strategically, culturally, operationally. I do find that most common is, somebody in the organization is tasked with, building out a direct to employer strategy or doing direct contracting as an additional responsibility. Sometimes that sits in a place like managed care. Sometimes that sits in a place like whoever's responsible for population health or care management. Those are the sort of most common areas that I've seen it sit in other organizations. I just think for us, it allowed us to really put a focus and a discipline around this and run it a little bit differently because, at the end of the day, this work, offering commercial products to employers and unions, that is very different than what the rest of the health system is set up to do. We leverage capabilities from the rest of the system. We leverage learning from the rest of the system, but this is fundamentally different. And so setting it up differently was the right decision for us. And I think has contributed to speed to impact and speed to success.
Yeah, that's fascinating. And so you also mentioned as part of this equation, partnering with best-in-class folks in various parts of it. Can you walk me through and feel free to, if you want to give shout outs to those partners if they have earned it.
We love our partners.
But where functionally did you realize you need to partner versus what your core competencies were? And, kind of would love for you to give me the lay of the land there.
Yeah. So again, we decided, we felt like we had something really unique and interesting that we could bring to the table in terms of, building a network that included, by the way, not just Northwell, but other like-minded providers in the market that have said, you know what, we want to be a part of this mission, solving for the affordability crisis too. And we've got the quality that can be complementary to us. So, Northwell's got 28 hospitals that are a part of its health system, but the Northwell Direct network has over 50 because of the partnerships we've created. Northwell employs around 8,000 physicians. Well, we've got over 42,000 physicians that are a part
Wow.
of the Northwell Direct network. So again, just giving you a sense of scale there, but we know how to build networks, we know how to partner with providers. And then we felt like we had a real strength in care management and wrapping clinical support services around members. I would say the area that jumped out most clearly to us was really around all of the insurance operations infrastructure, right? So think about claims processing, think about utilization management, think about customer service, producing ID cards, all of that core insurance operational infrastructure is not core to our DNA as a provider organization. And it would have cost a tremendous amount. It would have taken a really long time for us to build that. And, I wasn't sure that we could build it as good as some of the players out there in the market already. And so, we did a pretty comprehensive market evaluation to say, who are the independent third-party administrators out there that do that work all day, every day, and do it really well. And so we've built some great, really meaningful relationships with TPAs, people like Point C, people like WellNet, people like IBA, people like Personify. And interestingly, I think we made a decision early on. We were not going to create exclusive relationships. We wanted to find, and you heard me just name a few of the partners that we've built deep relationships and integration with in the TPA space. We wanted the flexibility to be able to have a range of options so that we could sort of curate a package of services that was tailored to the unique needs of any employer or union that we were interacting with. And I think that flexibility has helped us. And we've certainly learned a ton from all of those different partners that we've worked with over the years. And again, I think that flexibility, that agnostic approach, and then the deep integration that we've created with all those partners, I think it's been an asset to us as we've been out in the market.
Yeah, fascinating. And so you mentioned something kind of partnering on the traditional payer infrastructure, right? That you just don't really need to be competent in necessarily. But I would love for you to distinguish for me, down the line or today, like how does direct contracting compare to like traditional managed care? Like how would you distinguish those two groups, and how do you kind of avoid just going down that path? If that question makes sense.
Yeah, it does. I think the most fundamental difference is, and it's right in the name, direct. We are creating a direct, ongoing relationship with the employers and unions that we serve. Like, we brought our first customers onto the network platform July 1st of 2022. We've now got over 70 local, regional, national employers and unions that are using our network platform for their employer or union sponsored health plan. They represent over 300,000 members in the New York metro area and about $2.5 billion of medical expense that is flowing through the network and being managed on the platform. We've had a 97% retention rate over the last 4 years. The small handful of employers and unions that have left for two reasons. Number one, they got acquired by a bigger company that is rolling them onto their benefits. Can't control for that. Or they fell below the threshold in New York State, which is 100 employees, to be self-funded in your benefit design. Otherwise, all of the employers and unions that we serve are staying with us. And we're seeing that these truly are long-term relationships. And why are they staying? They're staying because they're seeing the financial value. We've saved over $150 million for our clients over the last 4 years. And they're staying because their employees or their union members are having a positive experience. If those conditions didn't exist, they wouldn't continue to do this. And so, us having that direct relationship, us sitting at the table with them month to month, going through how is the product performing? Are you seeing the value? Where do we have opportunity to develop new clinical interventions based on the data we're seeing? What additional support can we wrap around your members? Those features of this relationship are making it sticky and making the relationships deep. And, candidly, the other thing is, the burning platform here is this is a solve for the affordability crisis in healthcare. And so if employers are not seeing the savings, if we brought them in year one and in year two, we just jacked up the rates that they paid for care, they'd leave, because that's not why they've made the decision to opt into this product. And so we need to create a sustainable cost trajectory. We need to be sitting at the table, developing programs and support together. And these need to be deep and long-lasting relationships. And I think that's how we avoid the sort of pitfall that you outlined in your question, if that makes sense.
That makes a ton of sense. And you kind of alluded to some of the bullet points that have gone into your partnership with 32BJ. And so one, I would love for you to kind of talk about, how that was set up, what they cared about. They're very savvy when it comes to, they're very vocal about hospital prices and those sorts of things. So what made them come to the table? How was it collaborative? What were the sticking points? And then kind of we can go from there if that works.
Yeah. 32BJ has been a phenomenal partner, and it really has been a fantastic experience getting to know them and really thinking collaboratively together about how we could best support their union members and their families. And, a couple of things I would just say about them. Number one, they are incredibly sophisticated organizationally, and they have invested meaningfully in their health fund, in the capabilities to support that health fund. And they bring a level of discipline and creativity and sophistication to how they manage that is incredibly impressive. And frankly, that I've not seen matched in many employers or other unions. And so that's the starting point. You're starting with an incredibly talented partner, and that's a good starting point. And, I think they were ready strategically to get into the direct contracting space meaningfully. And we were at a point in our evolution that we were ready to handle an organization as big and as sophisticated as they were. So there's an element of timing that is helpful sometimes in these relationships. It's like that old right place, right time thing. We were both ready. We were both ready for this type of relationship. And we got introduced in August of last year. And for our very first meeting, I hosted them at our Greenwich Village Hospital, which is one of the most unique hospitals in the Northwell Health system. It actually started as a freestanding emergency department. It's since we've opened many other wraparound services, diagnostic services, some physician offices in the space, and actually an inpatient unit as well. But when it opened, it was a freestanding emergency department. And so there was an incredible amount of support that needed to be wrapped around a freestanding emergency department in order to be able to care for the members of that community. And I thought it really spoke to the innovative nature of the health system and that we could do things that were different. So we had the meeting there. And by the way, the building is actually the old Maritime Union Hall in New York City. So there was a cultural connection too. And, I think we walked away from that first conversation feeling like, wow, we're both ready. There's a high degree of cultural and strategic alignment here. And number three, that we had built something that was different than any of the other competitive health systems in the market. We had this dedicated infrastructure that was capable of delivering these solutions at scale. And so, it really felt like a light bulb went off, or that we really clicked in that first meeting. And so we set another meeting a week later with some clear deliverables, and we brought them to the table, had another good conversation, and we set another meeting a week later. And we got into this process of meeting weekly, of delivering in the next conversation what we both said we were going to deliver, and advancing this ball forward. And that led to a high degree of trust being built between the partners. And every week we were seeing that we were highly aligned strategically and in our objectives, and it reinforced that we were onto something. And then I would say the last piece that really helped sort of crystallize everything for us was that we used data. We used data to prove out that this solution was going to work. And so we brought in a third-party vendor that we've worked with to take 32BJ's claims and run them through a repricing exercise to actually illustrate, using their own medical experience, how much of a savings opportunity there was. And it brought a level of transparency and objectivity to measuring, right? It wasn't Nick and his team producing, an analysis. This was a third party that does this every day. And at the end of the day, it illustrated that there was a 20% savings opportunity, that 32BJ was going to save $46 million in the first year based on their historical utilization. And that really reinforced at the end of the process all of the great work we had done building trust and building a relationship and going through the objectives, such that in the middle of October, we shook hands and we said, we've got a deal. And so it came together really quickly, and, really, really proud of that hard work and the way that we approached it, because I think it set us up for launching and building on a foundation that's built for success.
Yeah. Thanks for that background. And it sounds like that partnership has really created even more of a critical mass for you guys as it relates to, potential other employers or unions and those sorts of things. And I think a lot of listeners will be interested to understand, you mentioned kind of the 20% year one. So maybe a two-part question is, what are the components of that, if you can break that down to the extent that you can? And then years 2 through 5 through whatever, how does it functionally kind of play out from a, cost containment perspective?
Sure. So there are a couple of elements to how we deliver this. First and most importantly, we have negotiated reimbursement rates with the providers. By the way, including Northwell, I have to negotiate rates with my own parent company because we're firewalled off from managed care. We have negotiated reimbursement rates for the employers and unions that adopt our network that are market leading, that yield a 20% savings relative to the traditional insurance carriers. And so they have access to those discounts when they implement this network solution for their employer or union sponsored plan. And that really is how, through the analysis, 32BJ was able to illustrate that there's a 20% savings opportunity. That's typically how other employers and unions see that there is a 20% savings opportunity. That to me is the starting point. It's the foundation. And we should, over time, be driving that number even greater. How do we do that? Number one, BJ has implemented benefit design to encourage their members, not require, to encourage their members to consider choosing a Northwell Direct participating provider or facility. Inpatient copays were taken down from $1,000 to $100. A physician visit with providers that participate in our network is now $0 copay. That is incredibly meaningful. In the current economic environment, as members think about where do they want to get their care. And so it's our belief that over time, additional members will choose providers and facilities within the Northwell Direct network. And that should accrue additional savings to 32BJ. By the way, at the same time, they project that it'll save their members about $5 million in copay expenses. So solving not only
There you go.
for affordability at the organizational level, but at the member level, which is significant.
Wow.
And by the way, we see similar benefit design put in place at our other employer and union clients. Third, care management. So as we think about how do we best support these members in their health and wellness journey, where can we create clinical interventions and programs that support all of the members that we serve? Those programs, whether it's work that we're doing around diabetes, whether it's work that we're doing with our chronic kidney population, whether it's transitional care management support, they yield better health outcomes that translate into incremental long-term dollar savings for union funds, for employer health plans. And so over the long term, that'll be important to cost trajectory. And then lastly, we put in place trend guarantees with 32BJ so that they would have predictability. Now, we've still got to go out and negotiate every year with our provider partners that participate, but we now know what we're aiming at and what we've got to deliver and what we've got to negotiate in order for this to bring the kind of predictability and stability that a union like 32BJ needs. And so that's sort of the set of levers that we've looked at short and long term. And I, as you said, for 32BJ, I believe the 46 million will be the starting point that we'll be building from. I believe the 20% that we talk about with all of the employers and unions we meet with is the starting point.
Yeah. That's awesome. And thanks for breaking that down. And so I guess this partnership was enacted in 2026. Is that correct?
Yeah, we went live in April.
Okay, you went live in April. So it's been about 3-ish months at the time of this recording. How would you say, it's going so far? Has there been anything that has gone wrong, gone really well? How would you kind of assess the current dynamic?
Yeah, I mean, I don't know if I should be knocking on wood or what, but it's gone incredibly well. We actually had our first executive steering committee just a couple of weeks ago, and everybody's feeling really good about where we've started. Members are having the right experience at the point of care. They're being charged the correct copays. Claims are flowing in the right way. Communications are getting out, and education is happening both on the provider side and the member side. So it's been relatively smooth. And I think, it in large part is thanks to the work that we did upfront as we were developing the relationship, the trust that we built along the way, the high level of integration that we created among our teams so that they're working in lockstep. All of those things, I think, contributed to us being set up for success. And then, we did other things using technology to make sure that there was belt suspenders wrapped around how the person at the front desk assesses what the copay is and what kind of systematic supports we could put in place. And so I think we made some smart decisions like that along the way, but really probably the greatest success factor has been, really what went into building the trust and building the relationship at the outset.
Yeah, you did all the blocking and tackling up front. So that's great. And glad to hear that. And so you kind of mentioned all of the value props for this relationship for 32BJ and other kind of large employers. I would love for you to dive into a little bit about what this arrangement unlocks strategically for you guys at Northwell and Northwell Direct, as far as, you have certain guarantees, right, in that partnership. So where do you kind of make that up strategically on your side? Like, is it with the volume? Is it with increased market share among employer population? Like, what does that kind of look like?
Yeah, I mean, I think the reality is, and let's just be really honest, transparent about it. The competition for market share is fierce in the New York metro market. And so this is a way, in addition to all the great things it does to support our mission, which was the starting point of our conversation, Blake, but in addition to all of that, it positions us to compete for greater market share. It positions us, to be the recipient of growth in the percent of utilization of Northwell by an individual population. And we do that in a way that's not punitive. We don't force a choice on any of the members that we serve. Rather, we create options for them. And we incentivize the choices in partnership with the employers and the unions that we work with. And so we've seen in the data that we look at with the employers who've been with us for a couple of years, as most of them have, we have seen growth in the share of their members that are choosing Northwell. And that's a strategic advantage for us as we think about the competition in the New York market, as we think about, the need to invest back into our clinical enterprise and generating revenue that can support the mission of the health system and, all the things that we invest in on a community benefit level. So yeah, transparently, that is the strategic advantage. And secondly, I would say this is about growth. This is a growth lever for the health system, both in terms of who we partner with and where, and the reach of individuals that we can touch and engage with through these direct relationships. And so, what are the strategic advantages of this? Number one, it's mission. Number two, it's market share. And number three, it's supporting the growth of the broader organization.
Yeah, that makes total sense. I mean, you wouldn't, from a business perspective or sustainability perspective, you wouldn't do something that wasn't, wouldn't pay you back in some other way. So just curious around like how you viewed that, especially with the dynamics in New York.
And look, I think that's why so many health systems around the country are thinking about these strategies, because they see that it can help them advance the ball in these sort of core strategic objectives, all of which, by the way, have the downstream impact of helping us to improve the health and well-being of the communities that we're a part of.
Yeah.
And so I think that's why this topic is increasingly of focus by health systems around the country.
Yeah, talk to me a little more. I would love to double click on that. Talk to me a little more about those ongoing conversations, because you guys are one of the first to do this at scale, from what I understand. Have other folks, other leaders reached out to you? What are their kind of common questions, and what advice or kind of commonalities would you give to those other leaders?
Yeah, there are. So I've spent a lot of time talking to health systems about this over the last 6 years. It is something I will always make time to do. I'm very passionate about the fact that I think the more of us that are doing this work, the better, because it takes away the newness factor of it that can sometimes make change seem scary. It normalizes it, and it demonstrates that this has scale, in the same way that a relationship in our local market with a 32BJ demonstrates that this has scale. So I spent a lot of time talking to hospitals, health systems around the country about direct to employer, about direct contracting. And, one, there are a lot that are trying to figure out how to get started. And my advice to them is always two things. Number one, start by having a conversation with an employer or a union in your market. They will give you the insights that you need, and they will help set you down a path. And then secondary to that, just pick one thing and start there. You don't have to try to do everything. Pick one thing, start, find the right partners to wrap around you and make it possible. So for those that are thinking about how to start, that haven't quite go down the road, that's often the advice that I'll lend them. And then what's also been really pleasantly surprising is there are other health systems who are doing this work meaningfully. So if I look at, Orlando, starting with the relationship that they created with Disney and that they've then built on. If I look at Henry Ford, if I look at Providence, if I look at Baylor Scott and White, there are great examples of other health systems who are doing this work. What's been great, though, is everybody's doing it a little bit differently. So I haven't found another Northwell Direct in, health system X, Y, or Z, but they're doing it a little bit differently. And what's been nice, because we're not competitive, is we can learn from one another. What are the best practices that we can share? what's worked in one market that may work in another. That sort of fraternity that we've created of people that are doing this sort of interesting, rewarding, but challenging work in a health system environment has been really, really encouraging.
Yeah, that's fascinating, and appreciate you diving into that a little bit. And you kind of talked about how different health systems are doing it differently. And I want to dive into maybe the critical side of this, or the bear case here,
Yes.
where naysayers who might say like, "Hey, this is not scalable. It only works with like certain critical masses, with certain populations, or self-insured employers, and those sorts of things." How would you kind of respond to people who would say like, "Hey, this is kind of more of a fad," or "This doesn't work because of this," like those sorts of things?
Well, I'd respond in a couple ways. Number one, I'd say, look what we've done in a very short period of time. It works. And even though it's new and different, and it, sounds a little bit more complex, we've built to 300,000 members in just 4 years' time. And we've generated significant savings, and we've seen the value ourselves as an organization. So I'd just say, look at our results, number one, as a proof point that this works. Number two, I would point to the breadth of interest in this. This is not one or two health systems talking about doing some novel thing. Pretty much every health system that I interact with across the country is thinking about this in some form or fashion. And so that to me speaks to the fact that it has sustainability to it. Third, let's just acknowledge the current cost trajectory is just not sustainable for healthcare. There has got to be a different way. And I believe that this strategy is the right answer, that it recenters the relationships directly between those that deliver the care and those that pay for the care. It reorients the entire system around that while unlocking the value. And that to me, speaks to it being the right answer to this crisis of affordability that I don't believe is going away. It's not unique to healthcare, by the way. We see it across the economy. But from a healthcare perspective, we think we're on to the right answer. So that's how I would answer it. I would say look at the results that we've achieved, the impact that we've had in a very short period of time. Look at the breadth of interest, and lastly, and most importantly, let's face the reality of we need to solve for this crisis of affordability. And I think recentering on the true payers and the providers of care and building the relationship around them at the center is the right answer.
Yeah, I love that. And that answer kind of draws a couple of other implications, I guess would be the right word there, around, potentially the future of managed care, right? So, let's play it forward a little bit, and let's say direct contracting continues to grow in prevalence in these health systems with, significant market share in various metropolitan areas. How do you kind of see the other side of the equation playing out as far as, managed care or the blues? What happens to them?
Yeah, look, and I told you I'm not a managed care expert.
Yeah. There's the caveat, everyone.
That's my caveat. But I'll play ball. Look, organizations have to evolve, and you're not going to do tomorrow what you did yesterday. And so, I can see the managed care world evolving. I could, see different payer strategies emerging. You could think about, does value-based care start to take off more meaningfully? Do managed care company organizations start to focus more there versus the traditional reimbursement models? Does this drive and create some creativity that then drives and feeds innovation in contracting in the other side of the health systems business? So I think there'll be evolution in the managed care function. I think tomorrow they won't do the same thing that they did yesterday. And I think fundamentally that is a good thing because it represents progress. I don't say and you haven't heard me at any point in this conversation talk about cutting out anyone from the equation or eliminating anyone from the equation. That would be a very, easy thing for me to say. It would sound snappy, but it to me is overly simplistic. I still think there's a role
Yeah.
for the national carriers. We partner with some of the national carrier networks to wrap our local high performance network with their network for local choice. So again, we're not taking anything away from members, and then national extension coverage beyond where my network reaches. There's still a role for them in doing that over the long term. There is still a role for them to play working with the employers and unions that we can't serve. And so the health systems will need to continue to have relationships with the large insurance companies, with the national carrier networks. Those relationships may just look different. Than they do today. They won't be the same tomorrow as they were yesterday. That's a good thing because it represents progress. And, candidly, I've been encouraged. And frankly, this goes back a little bit to your last question. But, I'll use Anthem as an example in our market. We've got a great collaborative relationship with Anthem today. We wrap our network with their national network, again, to provide local choice and national extension coverage. And it's been an incredibly productive relationship for us. And I think, you may ask yourself, why would they be interested in this? Number one, I think they see this relationship as an opportunity to do something new and different and win new business. I think they see it as a value add for existing customers and a retentive tool. And number three, in my view, they recognize the reality that the train on direct contracting and direct to employer healthcare had left the station. Hospitals and health systems across the country were committing to this, and it was better to be a part of the solution than to try to fight against it. And so, again, that to me speaks to a different kind of relationship that can be unlocked in the future as that evolution that we were just talking about occurs.
Very interesting. Yeah, I do think right now it seems like managed care has some questions to answer and some kind of business model evolution as we see all the PBM reform and everything in between, MA headwinds. So really appreciate that perspective. That's awesome. Nick, I have one more question. Just we're talking about kind of forward looking statements and those sorts of things. Anything you can share on the conversations front as far as upcoming partnerships or maybe more broadly, what can you kind of speak to what Northwell Direct's future holds?
So I can't name names.
Fair enough.
But what I would say to you is, look, we've got a lot of interest, and certainly the 32BJ relationship has helped with that, but so has the other success that we've had with our clients and the time that we've invested building relationships. And so, we've got a great team that has deep experience, deep relationships in the broker community. And we've invested a lot of time building relationships in the labor community. And the result of that is we're seeing a real increase in momentum in the market. We are going to have some significant announcements as we head into the end of the year and the sort of January 1st benefits renewal cycle. I'm happy to come back and talk about those, Blake, once
Fair
I
enough.
can put
Love
logos up and name names. But I suspect we will see significant growth in the coming months, the coming year, with some additional sizable unions and some additional sizable employer groups.
Okay, well, I'll definitely be following along. I'm very interested in this space. So thanks so much for everything you've shared today. And I do have one more question, which is more of a personal question that I ask every podcast guest. So thanks for indulging me. And really it is, what is an experience you've had or piece of advice or something you've consumed that has fundamentally changed how you live your life?
Oh, gosh, that's a great question. One of the things that attracted me to healthcare was the mission and the idea of being in service to something bigger than yourself and being a part of trying to execute a mission that can support, the health and well-being of communities. That was incredibly attractive to me and has been what's kept me in healthcare. And I don't deliver care myself. The last place you would want to see me, trust me, is in a clinical setting. But I can help the people that deliver care, and I can help bring innovative solutions to the market that facilitate access to that great quality care. And that has been sort of the driving guide and sort of driving motivation throughout my entire career in healthcare. And what I've been amazed by over and over again are the incredibly compassionate, just unbelievable clinicians that I've gotten to know and the relationships I've gotten to build over the last number of years. And, through this work. And it truly is inspiring and motivating and, sort of life-changing. And then when you go through healthcare or you experience healthcare, even as somebody that has worked in the industry their entire career, but then when you experience it on the patient side, knowing those people as well as you do, it truly is life-changing. And so we had an experience a number of years ago. My father actually had 2 strokes in a week's time. He's fine, by the way.
Wow.
Thankfully, because of the incredible care that he got, no physical, mental, other challenges resulting from that. But obviously, an incredibly scary time for my family. And to get to see and experience the clinicians that you've got to know and been so inspired by over the years, actually see them in action, helping your family through what is an incredibly scary, sort of dark time where you're thinking about the worst possible outcomes as opposed to the better. Just, candidly, to use your words, sort of life-changing and inspiring and reinforcing of the amazing work that is done in healthcare organizations every day, about the real impact that they have on real people. And it sort of reinvigorates you into wanting to be able to support them in everything they do to provide for patients, and wanting to do all I can every day in the work that I do to create these pathways to access for care for patients. And so that's what comes to mind. That's what's inspired me, that sense of mission and purpose, and trying to do something bigger than just myself for the community.
That's awesome. And I can see so easily how that energizes you. And I can literally feel through the screen your energy and passion. So, Nick, thanks so much for that response. And that's a great takeaway for today's conversation.
And can I just say, thank you. Number one, for having me today. Number two, for your interest in what I think is an important topic, what I think is a topic that has the potential to have a transformative impact on how healthcare is organized, delivered, and paid for across this country. But also, for the work that you do every day, diving into really complex topics in healthcare and making them really digestible, because this is a complicated, nuanced industry. And having people like you that are doing the work to help others understand that complexity and understand the kind of innovation that is taking place, I think is really important. So thank you for doing that work as well.
Thank you so much for saying that. That's incredibly flattering, and part of my mission, you talk about missions, is to disseminate that information thoughtfully. So that means a lot. It makes me feel like I'm doing a good job. So Nick, thanks so much for the conversation today. This was a ton of fun, and looking forward to following along with you and Northwell Direct in the future. And have a good rest of your Friday.
Thanks so much, Blake. Really appreciate it.